Okay, why don't we get started? Welcome everybody to the final entry in the 2020 through 21 CREECA lecture series. My name is Ted Gerber. I'm the faculty director of CREECA, or also known as the Center for Russia, East Europe, and Central Asia. And because it's our last lecture of the year, I don't have to refer you to our website to check our future schedule, but I will let you know that we will be resuming our lecture series in the fall of this year. And we're not yet sure whether we're going to be in person or online or probably some combination of the two, but keep posted with the CREECA website. That information will be coming out as the summer evolves. Also, let me know that it's not the final CREECA event of the year, that this Saturday, we are hosting a book launch via Zoom of Maria Stepanova's new book, The Voice-Over, Poems and Essays. And it will feature Stepanova plus the translators who brought this translation into being. So please do check out our website to see information on this event and also other events that will be coming up over the summer. Also, one other note before I introduce today's speaker, and that is I want to extend a particular thanks to our events coordinator, who is Veronica Hayes, and she is graduating from UW and thus leaving her position at CREECA, and it's been quite a joy and pleasure working with her. And she's the one who's made all of this online Zoom format work, and she's made sure nobody has stray microphones. She's helped all our lecturers get set up, and so I really want to acknowledge her fantastic work this year as we've moved into this virtual environment. And in terms of our virtual setup, those of you who have attended our Zoom lectures regularly know that we ask you to mute your mics and turn off your videos during the lecture, less pressure on the bandwidth, and to avoid annoying little beeps like you just heard from my email, which I failed to turn off before making this announcement. Also, we ask you to hold your questions to the end and refrain from using the chat. And when we do have the Q&A, please use the raise hand function, or if that doesn't work for you, then you can send me a message in the chat. I'll be moderating the discussion after the lecture, and we'll ask you then to turn on your mic and introduce yourself and your video before giving your question or your comment. So I'm really pleased to introduce today's speaker, who is Schenk, and she is an associate professor of political science at Nazarbayev University in Nur-Sultan, Kazakhstan. And this is one of the great advantages of the Zoom world that we live in now, that we're able to host CREECA. And I'm especially grateful to her because right now it's 3 a.m. in Kazakhstan. So she's quite graciously agreed to talk to us in our normal CREECA lecture slot, which is our tradition. She is an expert in the politics of immigration and national identity in Eurasia. She is a political scientist. And I have to say that I myself have learned a tremendous amount from CREECA about, from her work about immigration policies in Russia. Most notably, she published recently with University of Toronto Press her book, which is called Why Control Immigration, Strategic Uses of Migration Management in Russia. And I really think this is the authoritative book on how Russian migration policies have evolved and the factors that have gone in, the political economic kinds of factors that have gone into shaping Russia's evolving policies with respect to international immigration. She's also recently published an article in Nationalities Papers called The Migrant Other, Exclusion Without Nationalism. And she's also, finally, another impressive achievement, she recently got an NCEER grant for the Eurasia data collection part of the CoronaNet project, which is a project she's been involved in, involving collecting data about coronavirus policies across the whole Eurasia. I guess the itself is multinational, but she's been in charge of the Eurasian part of this. And I believe that's what she's going to be talking to us today. I've always really enjoyed hearing about CREECA's research because she typically presents a sort of skeptical, iconoclastic perspective, not afraid at all to take on conventional wisdoms. And so I'm sure we're in for a real treat. Her topic today is Eurasian responses to the COVID-19 crisis, between fact and fear. So welcome, CREECA, and I'll turn the floor over to you. And look forward very much to your lecture. Thanks.
Okay, thank you very much, Ted, for the gracious introduction. And I will indeed be talking about Eurasian COVID politics and responses. I'm getting my PowerPoint up. For some reason, I shut it down as I was getting ready. Okay. Can you see the PowerPoint?
Yep, it's up there. Perfect. You're
okay.
All...
Sorry. After all of this time of, of Zoom calls and all of these things, I still, for some reason, had a moment of hesitation. Okay, here we go. So Eurasian responses to the COVID-19 crisis between fact and fear. So what I want to share today is a new project that I began last August, which is funded by a special COVID-19 grant from Nazarbayev University. And we're at the stage where we've collected a ton of data and we're really slowly starting to wade through this data. So I have a really amazing team of student research assistants who have been crucial for the development of our data collection, instruments of our data collection and analysis, and my own mental health, because they've been really an amazing group of people that have pushed forward this project with me. So I specifically want to thank Eurasian, Alya, Takshan, and Pirizat for helping me pull together the information in this presentation, with the disclaimer, of course, that any mistakes or misrepresentations of the data are my responsibility and not theirs. So I titled this talk, Eurasian Responses to the COVID-19 Crisis Between Fact and Fear. But really what I'm going to talk about only implicitly addresses the between fact and fear part, because at this point the project is evolving so quickly that it's actually, the frames are shifting and all of these sorts of things. But I do implicitly talk, kind of address the idea of fear and fact as well. So what I'd like to do in the next few minutes is to explain the genesis of this project, which began even before the pandemic hit, and briefly kind of lay out the scope of our data collection strategy. And I want to take a purposefully data before theory type of approach, but I will suggest a couple of literatures that I'm spending time with that I find to be meaningful and inspiring, and then venture a guess as to how they might connect with what we're finding. And then I want to test out an initial framing of some of our data using a small selection of our most recent data. So this project is born out of my previous research, in addition to everyday experiences living for the last 10 years in Kazakhstan and traveling for the last 15 years in Eurasia. So my previous and continuing work has been on migration governance in Russia and Eurasia, as Ted mentioned. And in the area of migration, there's a really vast gulf between policy and policy making processes on the one hand, and the lived experience of those on the ground, whether that's migrants or bureaucrats or law enforcement agents. But this can't simply be explained as lawlessness or a predatory state or broken rule of law or bad governance. And I'm even increasingly dissatisfied with using informality frames like the dual state or network governance or corruption to try to explain why the state of affairs continues where the policies are so disconnected from everyday practices. And as I've lived in Kazakhstan and traveled in Russia, I've experienced this sort of disconnect between law and practice in many ways. And one of the most interesting and sort of funny, mystifying examples centers on the use of car seats, infant safety seats. So when I travel, I usually have at least one or two little people in tow, beginning from the time that they're, just a few months old, all the way through their car seat ages. And I have encountered a dizzying variation when it comes to how drivers, whether it's taxi drivers or whether it's my own personal friends, relate to car seat laws. So I've encountered friends and taxi drivers who will not take us somewhere without a car seat. I had another experience where a friend wanted to take my family on a road trip to Lake Baikal, and she tried to find a car seat from a friend. But in the end, she said, well, let's just go anyways without a car seat. But if we get fined, you have to pay the ticket. Okay. And then there was the taxi driver going from Novosibirsk to Tomsk, who insisted on schooling me in how to install a car seat correctly, even though it was my car seat that I had brought on the airplane. He would not stop when the baby was screaming so that I could take her out of the car seat. And then finally, when we did stop and we're finished with, sitting there in the parking lot, ready to go again, he just took off across the parking lot before I even had a chance to buckle her in. And I said, well, just wait, I haven't even buckled her in yet. And he said, oh, well, don't worry. It's actually no big deal. Just hold her on your lap. She'll be happier anyways. And so I think that these experiences really show how differently people relate to state regulations on a very kind of everyday level. So both my research on migration and these types of experiences have provoked a number of questions that can be explored, I think, by looking at a variety of different public policy areas, whether it's migration or healthcare or infrastructure. So I had already been thinking about research areas including vaccines and public health and safety and behavioral choices before the pandemic hit, but the pandemic offered a really equally great opportunity, plus the funding, to investigate these questions further. So some of the driving questions that we are asking in this project are, when does the law matter? And when and how do people follow the law? And more fundamentally, but probably more esoterically, what does this reflect about what people believe about the state, about risk, about their responsibilities to community, and how are those beliefs formulated? And in order to keep my foot in the political science world, I'm also asking, does the way that the government packages information affect belief formation? And then are people mobilized by, for example, fear or by some sort of rationalistic or numerically oriented packaging of data? Are they motivated by appeals to community, by public goods provision? And then what are the feedback channels that allow the government to get information from the public? And here there's an underlying question or assumption of whether the government adapts to public demands. And just to give you a preview of what we're finding, the government, at least in Kazakhstan, is surprisingly responsive to the public, much more than you would expect if you were looking at policymaking through an authoritarian lens, explaining political developments through the framework of authoritarianism. So because these questions are so wide and abstract, our data collection is what I call beyond mixed methods, because it's very eclectic. And I think that that's appropriate because I don't want to impose a theoretical framework on the data too soon. And oftentimes theoretical approaches come entangled with methodological norms and conventions that can get in the way of just kind of stripping things down, starting at the ontological level, moving towards epistemology, and letting that inform how we interact with our data and with our interlocutors. So even with the more quantifiable bits of our data collection, the guiding ethos is really ethnographic and from the ground up. And so, for example, even in our survey work, I see this as providing context for the ethnography rather than vice versa, using ethnography to kind of lead into figuring out how generalizable our findings are. But all of these data collection instruments, so we're looking at a structured participant observation, which I'll share a little bit with you in a few minutes. We're doing interviews. We've done a little bit of an analysis of conspiracy theories in Kazakhstan, some analysis on vaccine politics. We're doing a big media data collection project, part of the project. We have some survey, and we have, as Ted mentioned, structured policy analysis through the CoronaNet, which for today's talk is really kind of subsumed under this larger project. So all of this sort of data is really swimming around right now, and we've collected a lot of data, but it's really going to take some time to sort out what we think is actually going on. But today I'm going to share some of my initial impressions. So rather than a literature review or a kind of theoretical framing, let me just mention a couple of literatures that I've found influential and that are guiding how I'm thinking about the data that we're finding. It's also very eclectic. So I can't be a political scientist of Eurasia without mentioning the literature on authoritarianism. But basically that's all I'm going to do, and is acknowledge that it's there. But I'm increasingly skeptical that we can explain politics in Eurasia using regime-focused concepts. I actually don't think that's very controversial, though, because I think scholars of authoritarianism are increasingly using authoritarianism not as a variable, but as an entry point into deconstructing and redefining political processes. Another important literature is the informality literature. I think it's a really good and useful concept, informality, for studying Eurasia. I'm not sure that if it's really that it's really the appropriate framework for capturing what we are looking at in this project, though, in terms of, you know, COVID, as a way of looking at kind of belief state-society relationships and how states might affect those beliefs. Another interesting literature is kind of a conglomeration of everyday studies, which takes a page from the study of everyday nationalism. Also historical studies like Sheila Fitzpatrick's Everyday Stalinism. And I think this takes us a step closer to getting at what politics looks like for ordinary people outside of episodic or mobilizational moments. So there's also some, in addition to this, there's some interesting work being done on micro level analysis and social psychology, and a lot of great research being done in this area. A lot of it takes certainly an individual level of analysis, but it's not exactly every day. And I think that you know, I'm not really entirely satisfied with the level of nuance that some of these studies capture, because they primarily use survey data. So they're kind of giving us the thin top layer, which is generalizable, but not necessarily giving us a great deal of depth. The biopolitics literature and its associated branches are pretty interesting for thinking about the types of issues that we're interested in. So the biopolitics literature can help us rethink the state on some level, depending on who we take our cues from. So we could take cues from Giorgio Agamben with his very heavy-handed sort of top-down Schmittian approach towards sovereignty, or we could take a more stripped-down version of Foucault that can be used to think about the productive capacity of the state, which I'll unpack a little bit more in a few minutes. There's also a strand or an offshoot of biopolitical thinking that dissects the quantification of persons, which is absolutely relevant for our research, especially in terms of things like COVID case counts, death rates, and other official statistics, not only in the creation of these statistics, but also in the public display and the discourses that surround what can be a really hyper-numerical type of messaging. Biopolitics is also useful useful to the extent that it takes rhetoric and discourse seriously. And I think as a critical exercise, this is very useful. Ontologically, I lean a little bit more towards a realist position, but nevertheless, I think you know, biopolitics is useful, though it has certain limitations. Perhaps coming from left field is the literature on philosophy of religion. I'm not necessarily looking to include religion or even religious belief as a variable, but I do find the very well developed discussions surrounding the relationship between belief and reason that are located in the studies of philosophy of religion. These are very useful, interesting, very thought-provoking for how we study this belief, thought, behavior nexus. There's also some very interesting studies on the cognitive processes of belief. The limitations of this literature, though, is that it's primarily centered on non-Orthodox or non-Western or Western, non-Eastern Christianity. And so how much we can apply this to the Russian context or to a Muslim context like Kazakhstan is important to think through. And finally, intellectual history and epistemology are really interesting and important for contextualizing these thought processes that lead to belief and action by governments and by citizens, because these are embedded in specific historical contexts that need to take into consideration ideas and ideas transfer, as well as trends and fashions in how knowledge is produced and accepted. So again, these are all literatures that I'm reading at various different levels of interest and intensity. I'm not sure what will stick and how the intellectual trajectory of this project will end up. But please stay tuned for the next 5 to 7 years, because I think it will be an interesting journey of discovering the appropriate theoretical home for situating our findings. And I'm actually really not opposed to experimenting with different types of frameworks to see what might be a good fit by exploring alternatives. Okay, so for the rest of my time, I'd like to explore one potential framing of our data that I'm testing out. And it deals with the ideas of coercion, care, and trust. So coercion is a pretty traditional component, not only of authoritarian governance, but also is an essential part of state capacity. So also, since we're talking about how states message their populations, it's appropriate to mention the framework of informational autocracy, which can perhaps be seen as a type of coercive messaging. However, I think that the idea that skillful messaging can cover over bad policies, which is really central to the explanation of informational autocracies, I find that that really doesn't hold water in the Eurasian systems, because there's so little trust in the messages that the government puts out, especially in the areas that we're dealing with everyday things like health behaviors, that we really need to search beyond this to understand why governments message the way that they do, and then how the public accepts that. So there's at least a portion of the biopolitics literature that unpacks the idea that the state wants the population to be productive. Now, this is theorized in the context of liberalism and is specifically focused on economic types of productivity. So this is foundational to the very first conceptualization of biopolitics as outlined by Foucault. Now, I wouldn't say that it's accurate to say that Foucault was advocating for an ethic of care on the part of the state, because his concept of the population was an aggregate sort of mass of potentially productive economic inputs, not necessarily individuals in need of individual care. So Foucault's focus seems to be more on the strategies or the governmentalities, which are seen as rational efforts to make the population as a whole productive. Now, I could take a sort of public goods perspective on coercion versus provision, but I do think this biopolitics perspective really adds something important to conceptualizing those things that the state provides, or those ways in which the state tries to mobilize the productivity and kind of overall health of the population. But I'm not entirely convinced that biopolitics takes us all the way to explaining, especially an authoritarian ethic of care, which I should say is absolutely selective. This ethic of care is absolutely selective. So I'm not advocating that authoritarian governments, carte blanche care for their publics, but this ethic does exist. Even though it's selective, and that selectivity becomes really important. So for now, I'm going to leave the suggestion hanging in the air that engaging the biopolitics literature may be a way of helping us to think beyond current conventions and frameworks addressing authoritarianism. So my puzzle is this: why do states pursue conflicting tasks? So in the COVID-19 era, we can see that states pursue coercive enforcement strategies, something like police monitoring of masking orders or social distancing, alongside policies of care like free vaccines. Now, traditional answers would lead us in the direction of state interests, maximizing power or duration in office, or votes, or mobilization or demobilization, or perhaps providing public goods as facades or symbols in order to gain legitimacy. And all of these answers are fine, but they only tell us a part of the story. And the problem is, if we keep telling the same parts of the story over and over again, I think that we're going to lose the imagination to think that perhaps the story has another angle as well. And could that angle we are exploring be that even authoritarian states sometimes, in some circumstances, simply want to do a good job in order to care for their populations. But states are in a difficult position because in the Eurasian context, the populations generally don't trust states. And again, this is because the state's ethic of care is selective. So here's what we think is going on based on the data we have so far. The public wants a caretaking state, and I'll show you how we know this using data from one of our survey experiments. But when the state offers that care that the people want, the people don't trust it. So the argument I'm testing out is this, that the COVID-19 crisis has hit Eurasian governments where they are the weakest, where trust meets personal choices. So among populations that are used to having a state that doesn't reliably provide public goods, the pandemic has really shone a light on these sort of conflicting but mutually constitutive ideas that people have to take care of themselves, and that the state really has no or little impact on personal behaviors and personal beliefs. So even when the state provides care, it actually does very little to overcome existing distrust. Now, in the larger picture, my empirical focus for kind of testing this argument is vaccine hesitancy and the vaccine politics that are going on in both Russia and Kazakhstan. Today, I'm going to give you a bit of a wider sweep of the situation, not necessarily limited to vaccines. So none of these things are really new. Vaccine hesitancy is not new in Kazakhstan or Russia. Neither is a selectively caring state or public distrust, or really any of the ideas that we're exploring here. But COVID-19 does give us an opportunity to study these dynamics because they are increasingly salient. So first, how do we know that the public wants a caretaking state? And to make this argument, I'm drawing on results from nationally representative surveys in Russia in November of 2020 and Kazakhstan in February of 2021. So we included a survey experiment on these nationally representative surveys. Our sample sizes are a little bit different. In Russia, we have a sample size of 1,600. In Kazakhstan, a sample size of 3,000. And we randomly assigned respondents to one of three groups. The first group I call the coercion group. The second is the neutral or information group. And the third group is the care group. So in the coercion group, the respondents read this scenario. Imagine you live in a region that is seeing a sharp rise in the number of COVID-19 cases. Strict mask wearing policies are in place, but so far no general quarantine. In response to the pandemic situation, the government holds frequent press briefings to inform the public of the increasing number of fines given to people for not wearing masks. So this is the coercive message. Group two, that has the informational message or the neutral message, focuses not on the number of fines, but rather on press briefings to inform the public of the number of people infected with the virus. And then the care group gets, largely the same message, but at the end it's changed so that the government holds frequent press briefings to inform the public of the increasing number of vaccine doses available without cost to all who would like them. And then after this scenario, we asked people how effective they think these measures are for reducing the spread of the virus. Now, these are the results. On the left is Kazakhstan, or on the left is Russia, and the right is Kazakhstan. And the between group differences in Russia are statistically significant, but a little bit less so in Kazakhstan. Nevertheless, we see the same patterns, that the public accounts coercive messages and care-oriented messages as more effective, producing more effective results than sort of neutral or information-oriented messaging. So we know that the public wants a caretaking state, even though that's only slightly more than they want a coercive state, which is also interesting, but it's a question that I'm going to leave aside for right now. But we also see that the people don't trust the state's care that they want. So I'm going to show this in 3 ways. First, using our survey data on vaccination, using our participant observation data on mask wearing and social distancing, and then fleshing out some nuance through some of our interview data in Kazakhstan. So first, survey data on vaccination at this point will not be surprising to anybody who's followed Russian politics, except that our data, I think, shows actually even a higher vaccine resistance than in some other surveys. So this is Russia, and we see a vast majority responding no to how sorry, the question is stated wrong. The question is, will you get the coronavirus vaccine? And the no respondents are roughly half of our sample. In Kazakhstan, it is also a really vast majority that answer no, they will not get the coronavirus vaccine. Now, this vaccine hesitancy is despite relatively high levels of fear that people themselves or their loved ones will become seriously ill with the virus. So a vast majority, again, reporting in Russia that they are very afraid or somewhat afraid of becoming ill themselves or having a loved one become seriously ill, and similar types of results in Kazakhstan. Now, what this suggests is that people take the virus seriously. If they're afraid of the virus, they aren't denying that the virus exists. So even though people are afraid of getting the virus or becoming seriously ill with the virus, and even though they want the state to provide, they don't actually plan to take advantage of the state's care when it is provided. So let's look next at our participant observation data. And this is just from Kazakhstan. And this is just a selection of our data, but I do think it is suggestive. Now, this data is collected by student research assistants who are all throughout Kazakhstan in various different places. So they're collecting data in cafes, on public transportation, hospitals, clinics, parks, stores, any places that people go. And they have a structured set of things that they are observing, things like mask wearing, social distancing practices, enforcement, and things like this. And they input all of these observations into a Qualtrics survey so that we have a systematizable output. And then they can also add their observations, upload photos, documents, and things like that. So we see from these graphics that compliance with everyday policies on social distancing and mask wearing are pretty slim. So the general population, so we've done about, we've observed about 40,000 people in various public places. And we see that the general population practicing social distancing is pretty slim. So these kind of practicing, people that practice social distancing is about 29% of the sample, whereas people that, absolutely didn't practice social distancing is about 45. Over here, we see mask wearing by employees and business owners, which presumably should be a bit higher since they need to kind of set the example for the customers in their shops. We see that it's a majority of employees and business owners are either wearing masks only partially covering their face, which is this white section of 21%, or not wearing a mask at all, 27%. And then 12% not covering their faces. So we have, a majority of people really not wearing their masks correctly. Enforcement is also pretty lax. So here we see that, of 40,000 observations, we've only encountered 27 reminders by police or military to wear masks, whereas we see many, many more reminders by private security guards to wear their masks, which means that the enforcement is really being devolved to business owners. And so business owners are being fined more often than individuals are. But the enforcement of business owners is really quite variable. So my kids were telling me the other day in great detail which stores in our area neighborhood you can go to buy candy or whatever it is that kids buy without a mask. You can go to this store without a mask, but if you go to this store, you have to wear your mask. So if you forgot your mask, you need to change your mind and go to this other store. So this is very variable. So again, even though people may approve of coercive policies slightly less than care-oriented policies, it still doesn't have a very big impact on individual behavior, which is, again, surprising given the high levels of fear of becoming seriously ill with the virus. So I want to turn to our interview data for further clues to understand some of the complexity that we see. So far, we've interviewed almost 250 people, including medical personnel, other health experts, school administrators, social media influencers, state workers, and many average everyday citizens. And though we found really a lot of very interesting things, let me kind of distill it down to a couple of key points really briefly. It seems that people can be divided into several categories. Those people that trust the government, those people that generally distrust the government, but they kind of comply, they go along anyways, and those people that actively distrust the government. So those who trust do so either because they genuinely trust the government or because they don't really feel like they have a choice. And in both cases, government policies and government decision-making has a sort of a sense of inevitability. So for those that feel like they have no choice, they feel like they have to rely on the government, that there's really no other option. Some of our doctors fall into this category. So this first quote comes from a young female doctor in Nur Sultan. "I have no other choice but to trust the government. I do have doubts about their statistics, the incidence of infection, death rates, vaccination rates they provide, though." Others think that the government did the best that they could with a difficult situation. So we have this quote from an NU student at Nur Sultan. Well, honestly, they're really just doing everything that they can, right? If the government policy, usually people that have this type of opinions think that if the government policies didn't work, it might be because they weren't strict enough or because they didn't encourage compliance by giving people more information. So in the early stages of the pandemic, especially during quarantine times and in the height of the virus, which here in Kazakhstan was kind of in the middle of the summer, July, right around July, August, there was an appeal to fear and to really strict measures. There was a video that circulated last summer showing really full hospitals. People were laying on the floors. And these videos were really trying to scare people into staying home and to, stay socially distanced. There was also an increased police presence during the height of the quarantine that enforced mask wearing and stay-at-home orders with fines, with administrative arrests, and these sorts of things. I mean, there was a heavy police presence monitoring when people went outside of their homes. But I would say that this is not those people that trust the government. It's not a blind trust. It's a mitigated trust. It's a thinking trust. It's a critical trust. So we see from this bank employee from Nur Sultan that there was a feeling that the state did everything behind closed doors and it wasn't clear what was being decided. So even if I still trust, this person says, I understand that everything was very private. I would like their discussions to be more accessible, to know what they base their decisions on. So again, this is a critical trust, right? Trusting because there's not much of an alternative, but also kind of thinking about the deficiencies in why this trust might not be fully deserved. Now, this trust bleeds into the next category, where people are more distrustful of the government, but they still comply. They're still relatively compliant, at least to a limit. Now, what I find most interesting about this group is the idea that people assert the idea that they need to take care of themselves because they don't expect the state to do it. So even among those who trust the government, they understood and they believed, especially at the beginning of the pandemic, that the government and the healthcare system couldn't care for all people at an individual level. So this is a good example of that type of mentality from this housewife in Almaty. I was sick in June when everyone in the city knew that it was useless to call an ambulance because they didn't take people to the hospital, and often they didn't even come at all. The biggest problem is the fear that the state will not provide the necessary assistance to everyone. Now, many of our doctors that we've interviewed also fall into this middle group of not really trusting the government to provide necessary supplies, especially, and not accurately reporting statistics to the public. So shortage of supplies has been a really big problem. It's led to, doctors having only kind of a limited number of sets of PPE, personal protective equipment per month, like maybe even just 5 sets, which, these are obviously one-time use outfits, but they're only given 5, or maybe a few more, maybe a few less. It's very unpredictable what the government is going to provide. But there's also limits to this type of trust. And this, I think, is represented by this second quote from a language teacher in Almaty that demonstrates how people just kind of relaxed over time. So she says, you think to yourself, okay, nobody's going to protect me. I'm responsible for myself. I will protect myself. But at the same time, I will act in some places against the rules that the state has established. Well, we had it like this. We stayed at home for 3 months. I didn't even go out to the store. We were in strict self-isolation. We didn't go to relatives. We just stayed at home. And then as the absurdity began, the mess, actually, when this is the time she's referring to, when the case counts actually started spiking, everyone relaxed because they did not trust and they did not see the point in it. Now, these are the middle population, which is actually probably somewhat on the fence about things like vaccines. It seems like the things that garner the greatest distrust among this category and the next are things like the numbers about coronavirus, both the death rates and the case rates. And if these things are linked to corruption, it sort of activates a longstanding mistrust. But when these things aren't necessarily linked to corruption, there's probably more room to influence this group to comply with certain policies, including things like vaccinations. Now, vaccinations are not compulsory in Kazakhstan, like mask wearing policies or business closures. But I think that this middle group is probably the group that is most willing to be kind of influenced. And then finally, we have a group that actively distrusts the government, and they promote conspiracy theories like the government has created the virus, the government airdropped the virus out of helicopters. Now, for our data, we really need more interviews of this group directly, since what we have for the most part is respondents who kind of report on conspiracy theories that other people believe. Now, the media really doesn't seem to be helping on this note in relation, especially to things like vaccines, because the media tends towards a just the facts type of reportage without a lot of analysis or explanation. So when there are reports about people dying after being vaccinated or contracting the virus after vaccination, people don't really know what to do with this information. And there's not an effort on the media to kind of unpack what that means in kind of epidemiological sorts of language. Now, I think it's likely this media and communication nexus that fails to overcome the gap between government care and people's willingness to accept that care and be vaccinated. So I have a couple of interview excerpts here that are not necessarily as much about distrust, but about the utter irrelevance of government policies on people's everyday lives, because other things just simply matter more. So one person says, people rarely think with their head, they think with their pocket. And on a related note, another person says, people are not afraid of the state. People are afraid of losing money. And then a third person really gets at some of these social aspects when she says, it seems to me that mentality and culture play a big role in why people don't follow restrictive measures. So despite all the risks, despite the fact that you yourself can die, you are more worried about what your relatives will think of you if you don't go to a funeral. It will be a shame. They will be offended by me. Then they will not want to communicate with me. For people, the opinion of others is more important than their own safety. So what do we take away from this in terms of the caring state, the coercive state, and trust in government? So my conclusions are still pretty preliminary, but I will say that the picture doesn't really look that promising at the moment. People really mistrust the state because of past experiences, and especially because of a knee-jerk reaction that links corruption and distrust. So from an interview with somebody from Ministry of Health, the question is, how can we make sure that people do not believe in, that people who do not believe in the state begin to believe in it? And the answer is, I do not know, honestly. In general, outside of the pandemic, the problem has long been that there is no trust in the state. During the pandemic, this issue took on even greater momentum. I do not follow politics in general, but I know that there is large embezzlement of state funds. And so this kind of highlights this very knee-jerk sort of reaction that if people don't trust the government, it's often because of corruption. And corruption is actually an assumption that people just kind of take for granted when interacting with the state. So even now that the state is actively promoting vaccination, uptake is still pretty low. Though there's a funny kind of development in the last week or so, that now that they've announced that the Kazakhstani produced vaccine is ready and is going to be introduced into, kind of circulation, people are feeling pressure to get the Russian vaccine, which has been the only one that's been available up to this point, because they're afraid that they won't get a choice and they'll end up having to take the Kazakhstani vaccine instead of the Russian vaccine, whereas before they didn't want to take any vaccine at all. So it seems to me that the weak point here is the messaging, or those things that would create contact points between state and society. So we know that the government is actively making decisions. Sometimes these decisions are slow. Oftentimes they're imperfect. Certainly they're utilizing pockets of corruption. So we do have some evidence of, certain types of corruption schemes that have happened during the pandemic. I haven't really sorted them out in any sort of systematic fashion, but we know that they're, we know that they exist for sure. So whatever ethic of care the state has, it is really entangled with all sorts of other interests and priorities. And as a result, people are doing their own thing. They're looking out for themselves and their families. They avoid interacting with the state as much as possible. They disregard a lot of the policies. So now, we're in a situation where we've seen a big spike again in Kazakhstan. First, because 5-6 weeks ago was the Nowruz holidays, and people were getting together, and then there was a big spike after people were getting together. Now we're in Ramadan and people again are getting together. So even though restaurants are supposed to be closed in the evenings, there's still these sort of iftar celebrations that are taking place, and the cases are spiking as a result. So people are kind of generally disregarding government policies. And this is where things stand right now. They're still developing, kind of on the ground as we see dynamics developing, and we're still really trying to just make sense of it all. So I'm really interested to hear your reactions, your thoughts, and your suggestions, but I'm going to leave it here. And thank you very much. I appreciate the invitation and the ability to just discuss these things with you. Thank you very much.